Hello student, today topic of lecture general arthro-syndesmal J. Next question, classification of joints, fibrous joint, cartilaginous joint, synovial joint, selected synovial joint. The rigid element of the skeleton meets at sides called joints or articulation. The Greek root arthro means joint, and a scientific study of joint is called arthrology. Two important functions of bone are support and movement. It's the articulation of bones at joint and the contraction of skeletal muscles that attach to the bones that cause movement. Joints can be classified either by function or structure. The functional classification focuses on the amount of movement allowed. A. Sinusoids are immovable joint. B. Amphiarthrosis are slightly movable joint. And the next, diarthrosis are freely movable joint. Diarthrosis predominate in the limb, whereas sinusoids and amphiarthrosis are largely restricted to the axial skeleton. The structural classification is based on the material that binds the bones together and on the presence or absence of joint cavity. Structurally, joints are classified. Faster joints, synusoids, are continuous connections. Through joints, diarthrosis as discontinuous. False joints are immovable articulation characterized by filling tissue between the skeletal elements. There is no joint space. They are referred to a fibrous joint, syndesmosis. The synchondrosis, the synostosis. In contrast, true joint have a joint space between the articulating skeletal element. Fibrous joint, sutures are these. The bones are tightly bound by a minimum amount of fibrous tissue. Sutures occur only between bones of the skull, and the fibrous tissue is continuous with the periosteum around the flat bones. Sutures not only knit the bones together, but also all of growth so that skull can expand with the brain during childhood. Different theta's. Theta sagittal, theta coronalis, theta lambdoidea, theta squamosary, theta plana. This is a type of theta of the skull. What you see, a theta line between bone plane. You see, this is dense fibrous connective tissue. This is theta between bone os frontale, os sphenoidale, os parietale, os temporale. Now, for example, thetas of skull. What you see, theta coronalis, theta sagittalis, coronalis, thetas. This is, you see, theta lambdoideus. This is from os frontale, os parietale, os occipitale, os temporale, and os sphenoidale. This is, you see, theta. Next example, gymphosis. Gymphosis is back in socket joint. The only example is the articulation of the tooth or dents with socket. In this case, the connecting ligament is a short periodontal ligament. What you see, periodontal ligament. Gymphosis or bed and socket fibrous joint. This is dense. This is root of tooth. This is, you see, socket of alveolar process of bone. This is, you see, periodontal ligament, connecting ligament. This is gymphosis. Syndesmosis. In syndesmosis, the bone are connected exclusively by ligaments. Band of fibrous tissue longer than those that occur in theta. The amount of movement aloft at syndesmosis depends on the length of connecting fiber. If the fiber are short, as in the distal tibiofibular articulation, little to no movement is allowed. What you see, this is tibiofibular articulation. This is syndesmosis. Ligament. If the fibers are quite long, as in the interosseous membrane between radius and ulna, a large amount of the movement is possible. It is, example, syndesmosis. tibiofibular articulation, interosseous membrane, interosseous membrane. Next, synchondrosis, a joint where hyaline cartilage unites the bone is synchondrosis. Their epiphyseal plate are synchondrosis. Another example is the immovable joint between. This is immovable joint. Another example is in the immovable joint between first ribs, costal cartilage, and manubrium of the sternum. This is example synchondrosis. This is os humerus, head of humerus. Next, synostosis. Two bones are secondary fused by bone tissue. For example, sacrum consists by 5 bones. 1, 2, 3, 4, 5. This is transversal line. Forms unit of organ os sacrum. And next, hips bones is consists by 3 bones. Next, symphysis. Joint where fibrocartilage unites the bones in symphysis. Example includes the intervertebral disc and the pubic symphysis of the pelvis. Symphyses are slightly movable joint that provide strength with flexibility. It is example symphysis, pubic symphysis, and fibrocartilaginous intervertebral disc. What you see, part of the vertebra. What you see, hyaline cartilage. True joint. General structure of synovial joint. You see a typical synovial joint. Synovial joint include articular cartilage of bones, joint cavity, synovial cavity, articular capsule, synovial fluid, a reinforcing ligament, articular discs, and meniscus. What you see, frontal section through the shoulder joint. What you see, articular cartilage of bones at the head of humerus. You see cavitas glenoidalis of scapula. What you see, articular cartilage, hyalina cartilage. This is synovial cavity. Articular cartilage. The end of opposing bones are covered by articular cartilage composed of hyalina cartilage. These spongy cushions absorb compressive forces placed on the joint and thereby keep the bone ends from being crushed. Joint cavity, a feature unique to synovial joint cavity, is really just a potential space that holds a small amount of synovial fluid. Joint cavity. Synovial fluid. The viscous liquid, the joint cavity, is called synovial fluid because it resembles raw egg white. Synovial fluid is primarily a filtrate of blood arising from capillaries in synovial membrane. Whatever you see, synovial green color. Synovial, you see synovial membrane. It also contains special glycoprotein molecule secreted by the fibroblast in the synovial membrane that make synovial fluid a slippery lubricant that aids the movement at the joint. Articular capsule. The joint cavity is enclosed by two-layer articular capsule or joint capsule. You see capsule. The outer layer is fibrous capsule of denser irregular connective tissue that is continuous with periosteum layer of joining bones. The inner layer of the capsula is the synovial membrane, composed of loose connective tissue. Denser, loose connective tissue. This membrane covers all the internal joint surface not covered by cartilage. Its function is to make synovial fluid. This is capsule, articular capsule. It is structure of typical synovial joint. Some synovial joints are reinforced and thined by bank-like ligament. Most often, the ligaments are intrinsic or capsular, that is, they are thickened part of the fibrous capsule itself. In other cases, the ligaments are extracapsular or intracapsular. Extracapsular ligaments are located just outside the capsule. For instance, the fibular and tibial collateral ligament of the knee. Extracapsular ligaments are divided according to their functioning. This reinforcing ligament of the joint capsule, the big pubofemoral of hip joint, elbow joint, or hip joint, pubofemorale, sorry, the big pubofemorale at the hip joint. Next, gilding ligament for the guidance of joint movements. For example, the ligament annula radi at the elbow joint. And next, inhibiting or restricting ligament joint movement. For example, ligament iliofemoral at the hip joint. What you see, example, knee. This section, a section of the knee. What you see, femur. This is articular capsule, articular capsule, articular capsule. You see joint cavity, and you see extracapsular ligament, ligamentum extracapsularis, extracapsular ligament. Now you see blood vessels to the joint, blood vessels, joint. What you see, articular disc, this is cavity, capsule. What extracapsular ligament. Next, articular disc. Certain synovial joint contain a disc of fibrocartilage called articular disc or meniscus. Articular disc occur in temporomandibular joint, sternoclavicular joint, sternoclavicular joint, and few other. Such a disc extends internally from the capsule and completely or partly divides the joint cavity into what cavities? Next, what two cavities? This is articular disc. Articular disc occur in joints whose articulating bone ends have somewhat different shapes. An articular disc fills the gaps and improves the fit, thereby distributing the load more evenly and minimizing wear and damage. This is, you see, sternoclavicular joint, anterior sternoclavicularis ligament, and joint capsule. You see, почему? Сейчас я пойду к Сергею. А я тут разъеду. А я тут наслаждаюсь. Сейчас. Ага. Вот.
Раз, два, три. Микрофон работает. Да и вас видит. Кто сказал, что вас
Вот сейчас пишут студенты, мне сейчас завкафедры звонит, говорит, вас не видит и не слышит. Сейчас нет обратной как бы связи, когда так обычно читаешь, там спросишь,
Ну, у них может какие-то.
Хи, а они тебе, да, мы слышим, вот когда через Zoom. А я сижу тут, балдею, читаю, рассказываю.
Да нет, должны слышать. Сейчас проверю на сайте. Читайте дальше.
Сейчас, то есть она, может, пишет, они потом прочитают тогда, так что...
Да без понятия. Да должны слышать, сейчас я зайду на сайт проверю.
А мне что делать, остановиться пока?
Да пока читайте, что. Я не вижу технических проблем пока.
Угу, сейчас. Мария Руслановна, Сергей подошел, говорит, что у меня здесь никаких технических проблем нет. У меня все пишет. Ну, он и говорит, читайте дальше, говорит, я пойду еще посмотрю. Он говорит, у вас, ну тогда потом прочитаю, если она запишется. So, next. Menisci. Menisci articulum also consist of dense connective tissue and fibrous tissue. They look crescent-like, seen from above, and wedge-shaped in profile. And they cover the margins or the periphery of the joint surface, medial meniscus, and lateral meniscus, or the knee joint. Now you see medial femoralic condyle. What do you see? Femur. And you see tibia and fibula, os tibia, os fibula. Between two bones located lateral meniscus and medial meniscus. And you see on crescent like seen from above, what you see anterior cruciate ligament, and lateral meniscus. This is, you see, fibula ligamentum, fibula collateral ligament, and you see tibial collateral ligament. This is capsule, is absent. What you see, this is medial femoral condyle, and you see anterior cruciate ligament and medial meniscus on medial tibial condyle, and you see lateral meniscus. This is, you see, photograph of an opened knee joint. Next, joints, lips. These structures are composed of connective tissue and fibrous cartilage, and they sought to enlarge the socket of joint. In the human body, join lips, join lips, join lips, join lips, labra are founded in shoulder joint, labrum, glenoidale, and in hip joint, labrum, acetabule, labrum, acetabule. They are anchored in the body ring, limbus, of respective joint socket. And you see joint lips, joint lips. Joint lips, acetabula labrum, and acetabule labrum. Thus you see articular capsule, cut, head of femur, ligament of the head of the femur.
Вас прекрасно слышно и видно. Все хорошо.
Спасибо. Bursa is structured like a joint capsule. It is surrounded by a layer of connective tissue, membrana fibrosa, and inside the synovial membrane synovialis. Марина Александровна, они, наверное, зашли в 342-ю аудиторию. Ну, значит, они меня найти не могут, Сергей меня проверил, сказал, что все записывается, меня слышно все. Это здесь у нас нормально, сказал Сергей. Ну, пусть я пишу дальше. The composition of fluid is almost the sliding of tendons and muscles on bones and tendons. They can communicate with the joint cavity. For example, a clear and independent bars. Bursa prepatellaris. What you see? Suprapatellaris bursa. This is subcutaneous prepatellaris bursa. And you see deep infrapatellaris bursa. This is, you see only synovial cavity. This is suprapatellaris bursa. And you see sagittal section through the right knee joint. And this you see articular capsule. You see lateral meniscus. Lateral meniscus. You see patellar ligament and other. This is bursa, that green color. Next question, types of joint. Joints typically have a significant range of motion and can be classified according to number of movement axes according to the body axis or degrees of freedom. First, uniaxial, this ankle joint, and biaxial joint, wrist joint, and multiaxial, you see shoulder joint. This is three types. Independent number of movement axes, uniaxial, biaxial and multiaxial. Number or articulating skeleton element: simple joint, composite joint. Simple joint, two bones articulate with each other. What is this? For example, medial clavicular joint. Composite joint, several bones articulate with each other. For example, elbow joint, knee joint. This is, you see, three bones. This is humerus, ulna, radius. It is composite joint. A form and shape of joint surface: cylindrical or roll-like joint, ginglymus joint. It is a uniaxial joint which allow flexion and extension. For example, talocrural, articulation, humeri ulnaris. Next, pivot joint, uniaxial joint, which allows rotational movement, articulation radio ulnaris proximalis. You see, this is incisura, this is circumflexa, articulation circumflexa. Incisura, you see, articulation radio ulnaris proximalis. Pivot joint, uniaxial. Rotatus as a joint head of radius in concave joint cavity. We like or trochoid joint, unique axial, which allows rotational movement. For example, articulation atlanta axialis mediana. What you see? Two atlas and axis, vertebra of cervical section of vertebra. Condyloid or ellipsoid joint, articulation ellipsoidea, biaxial joint, which allows flexion, extension, abduction, adduction, and slight rotatory movement. For example, proximal wrist. Articulation metacarpophalangeas. This is ellipsoidal joint. Next, saddle joint, biaxial joint, which allows flexion, extension, abduction, adduction, and slightly rotatory movement. For example, carpal, metacarpal joint, carpal-metacarpal joint of the thumb. This is first finger. What you see, biaxial joint, saddle joint, biaxial joint, the simple joint, diarthrosis joint. Next, condylar joint. Next, they have similar curved, they have similar curved surface like ellipsoid and cylindrical joint. These joint allow rotational, shifting and rolling movements. Example, joint tempomandibularis. Joint tempomandibularis. This is temporal bone. This is, you see, mandibula. Next, ball and socket joint, articulatia spheroidea, joint with three axes, which allows flexions and extensions, abduction and adduction, internal and external rotation, as well as rotatory movement. For example, shoulder joint. 3 axes, ball and socket joint. Plain or flat joint, articulatia plana. Joint which allows simple gliding movement in different direction. What you see between articulation superior and inferior of vertebra. You see, this is plain joint. What you see? Plain joint between superior and inferior articulation of atlas and axis vertebra. This is a thoracic section, plain joint between inferior and superior processus articulatia. Superior and inferior. Next, movement at synovial joint. Synovial joint are classified into 3 basic types. Gliding of the one bone surface across another, angular movements which change the angle between the 2 bones, rotation about a bone's long axis. 3 basic types. Gliding is gliding the nearly flat surface of 2 bones slip across each other. Gliding occurs at the joints between the carpalis and tarsal, and between the flat articular process of vertebra. Gliding. What you see? Gliding movement at the wrist, Angular movement. Angular movement increase or decrease the angle between two bones. This movement, which may occur in any plane of body, include flexion, extension, induction, adduction, and circumduction. Flexion decrease the angle between two bones. Extension increasing the angle between bones. Abduction moving a limb away from the body midline. Adduction moving a limb towards the body midline. And circumduction moving a limb or finger so that it describes a cone in space. Angular movement. For example, movement. Elbow joint. Axis transversalis. This is extensio or flexio. Carpal joint. Flexio, extensio. And hip joint. Axis transversalis. This is flexio, extensio. This is type move. Movement in sagittal plane. Shoulder joint, movement in frontal plane. Abductor, abduction, adduction. Next, carpal joint, movement and the frontal plane, abduction ulnaris and abduction radialis. Next, hip joint, movement in the frontal plane. You see adductor and abductor. In frontal plane, movement. Rotation. Rotation is a turning movement of the bone around the longitudinal axis. This is only movement allowed between the first two cervical vertebrae. The entire vertebral column also rotates, twisting the whole trunk to the right or left. Rotation also occurs at the hip and shoulder joint. Rotation on the limb may be directed towards the median plane or away from it. For example, medial rotation of the lower limb, the medial anterior surface turns toward the median plane of the body. Lateral rotation, the opposite movement. This is shoulder joint. Movement, rotation external and rotator internal. Supinator and pronator. The terms supinator and pronator in Latin refer to movement of radius and radius around ulna. You see radius and you see ulna. Supination occurs when the forearm rotates laterally. So the palm faces anteriorly, the hand is lying on its back supine. Supination, supine. This is standard anatomical position. Pronation occurs when the forearm rotates medially, so that the palm faces posteriorly, hand lying belly side down, as is prone forward. Pronation brings the radials across the ulna, that the two bones form an X. Movement: supination, supinatia, pronatia. Supination, supinatia, this is, you see, pronatia. Supinatia and pronatia. Palm faces anteriorly. Palm, you see, side down belly. The key feature of body joints. Joint, you must know joint, articulating bones, functional type, structural type, and movement allowed. And you see table of structure and functional characteristic of body joint. You see joint, vertebra and thoracic type. What you see, classification of joint include articulating bone, structural type, functional type, movement allowed. Now, for example, intervertebral joint between adjacent vertebral bodies. Structural type, cartilaginous symphysis. Amphiarthrosis, slight movement. Intervertebral, what we see, this is between articular processes, synovial plane, diatrosis, gliding. Now, for example, joint of upper limb. What you see, shoulder joint, articulating bones, scapula and humerus. Structural type, synovial, ball and socket. Diatrosis, multiaxial, movement, flexion, extension, adduction, circumduction, rotation of humerus arm. For example, wrist. This is radius and proximal carpalis. Synovial, condyloid, diatrosis, biaxial flexions, and other. This is, you see, characteristic of joint of upper limb. You will study on the lesson next. For example, joint of the bones of the lower limb, sacroiliac joint, include two articulating bones, sacrum, what you see, and coxal bone. Structural type, synovial in childhood, is increasingly fibrous in adult. Diatrosis in childhood, modified amphiarthrosis in adult. For example, hip coxa joint, two bone, coxal bone and femur, synovial ball and soft, diatrotic multiaxial, and other movement, flexion, extension, adduction, rotation, and other. Knee, tibiofemoral knee. Вот он, tibia. Tibiofemoral. Include, you see, femur and tibia. Synovial modified hingle contains articular disc. If you disc composed joint, diatrotic, biaxial flexion extension of leg, some rotation allowed. Ankle joint, what do you see? This tarsometatarsal. What do you see? Synovial. You see between what an ankle. Do you see? Synovial line, large. For example, tibia and fibula with talus, synovial hingle, diatrosis, thoracic, uniaxial, and other. Many joint. You must know this joint. Selected synovial joint, for example. So, temporomandibular joint is modified hingle joint. It lies just anterior to ear. At this, the head of mandibular articulates with the inferior surface of squamosal temporal bone. The head of mandibular is egg-shaped where the articular surface on the temporal bone. Temporal bone has a more complex shape. Posteriorly, it forms the concave mandibular fossa. What you see, mandibular fossa, articular tubercle. You see zygomatic process of temporal bone. Anteriorly, it formed a dense knot called articular tuberale. Enclosing the joint is a loose articular capsule, the lateral aspect of which is thickened into lateral ligament. Within the capsule is an articular disc, which divides the synovial cavity into superior and inferior compartment. The two surfaces of the disc allow distinct kind of movement at the temporomandibular joint. This is capsule. Synovial membrane. This is synovial cavity. Mandibular fossa. You see mandibular condyle. What inferior joint cavity. Capsule. Next example, shoulder joint. Shoulder joint This ball and socket joint is formed by the head of the humerus and the shallow glenoid cavity of the scapula. Even thought the glenoid cavity is slightly deepened by a rim of fibrocartilage called what you see, glenoid labrum. Glenoid labrum. Glenoid labrum. This hyaline cartilage cavity. The articular capsule is remarkably thin and loose, qualities that contribute to the joint's freedom of movement and extend from the margin of the glenoid cavity to the anatomical neck of the humeri. You see fibrous capsule. Glenoid labrum, synovial cavity, hyaline cartilage, and subacromial bursa. Tendon sheet. The only strong thickener of capsule is the superior coracohumeral ligament, which helps support the weight of the upper limb. The anterior part of capsule thickness slightly into 3 razor weak glenohumeral ligament. Muscle tendons that cross the rear shoulder joint contribute most to the joint stability. This is you see acromion, coracoacromial ligament, fibrous capsule. This is you see tendon sheet, tendon long head, or bicep brachial muscles, synovial cavity in the other. This is glenohumeral ligament is absent on the picture. What you see? Open left shoulder joint. You see head of humerus, muscles of rotator. This is cut. This is capsule of shoulder joint opened. This glenoid cavity of scapula. This is you see scapula. You see acromion. This is muscles. Next joint, elbow joint. The elbow joint, humero-ulnar joint. Ulna, humero joint. Humeroradialis joint and the proximal radio-ulnar joint. These 3. This composite joint is a hingle that allows only extension and flexion. Even third, both the radius and ulna articulate with the condyle of the humerus. It's close gripping of the humerus by the ulnar trochlea notch that forms the hingle and stabilize the joint. Now you see mid-sagittal section through right elbow lateral view. You see only humero-ulnar joint. Do you see elbow joint cadava photo? The articular capsula, capsule attaches to humerus and ulna and to the annular ligament. What you see, annular ligament of the radius, a ring round head of the radius. Laterally and medially, the capsule thickness into strong ligament that prevent lateral and medial movement. The radial collateral ligament, a triangular band on the lateral side, and ulnar collateral ligament on the medial side. Tendons of several arm muscles, such as biceps brachii and triceps brachii, cross the elbow joint and provide stability. This is medial epicondyle, this is annular ligament, ulnar collateral ligament, this is bone radius, this is coronoid process ulna, this is ulna, this is olecranon ulna process. Now you see, repeat. Wrist joint has two major joint surfaces, radiocarpal joint and midcarpal joint, intercarpal joint, midcarpal joint. The radiocarpal joint is the joint between the radius and proximal carpals, the scaphoid, os scaphoideum, and os lunate. This joint is condyloid joint, permitting movement of flexion, extension, abduction and circumduction. The intercarpal joint, what do you see? Radiocarpal joint, at the wrist joint. You see radius and os scaphoideum, os lunatum. And next, intercarpal joint. Intercarpal joint is a shape, S-shape. This intercarpal joint has S-shape form. S-shape. The intercarpal joint is located between proximal and distal rows of carpals. Gliding occurs at this joint and the adjacent carpals slide but each other. The wrist is stabilized by several ligaments. Four major ligaments extending from forearm bones to the carpals reinforce this joint. The palmar radiocarpal ligament. Anteriorly, the dorsal radiocarpal ligament posteriorly. The radial collateral ligament, what you see? Radial collateral ligament laterally, and the ulnar collateral ligament medially. There are multiple small ligaments extending between carpal bones that connect the carpals to each other and to the metacarpals. So, student, attention. Thank you for the intention. Thank you very much. Goodbye.